The long-awaited and highly anticipated First Minister's meeting on health comes after health ministers failed to reach a deal late last year. And of course, as Canada's healthcare system reaches crisis levels from coast to coast to coast. What will the feds and provinces do to address that? Intergovernmental Affairs Minister Dominic LeBlanc oversees the relationship with provinces. He's with us live now. Hi, Minister. Good to see you as always. Thanks for making the time.
Hi, Vassy. Good evening.
I spoke with Heather Stephenson, and the interview is going to air in just a few minutes. She's the Premier of Manitoba, heads up what's known as the Council of the Federation. And she says that your government has not provided the provinces with any specific proposal at all on what you will be doing when it comes to funding, for example, and that the provinces have not folded on the idea of not attaching strings to money. Is that true?
I had a very good conversation with Premier Stephenson a week ago and again last evening, Vassy, and a number of her colleagues as well, as did the Prime Minister last evening. That is precisely the conversation that we want to have with them in a collaborative and respectful way in less than 2 weeks in Ottawa. We're optimistic that there's much more in common than there might be in terms of differences. That's why we hope and believe that we can quickly arrive at the right agreements to improve the healthcare system for Canadians. Your introduction talked about the strain, the pressure on the healthcare systems across the country. You're absolutely right. We know that. The premiers know that. More importantly, Canadians know that. So we think it'll be a constructive and positive meeting, and we have no reason to think that what the Prime Minister will lay out for the premiers on the 7th of February can't form the basis of we hope, a quick process to arrive at those agreements.
Let me just be clear, though, because a few months ago, I remember speaking to multiple ministers, representatives of the federal government, who said, look, before the Prime Minister meets in person, after the premiers had been pleading for that meeting for months, before he meets in person with the premiers, there's got to be some agreement on accountability attached to any new money that will flow from the federal government to the provinces. Premier Stephenson is saying they have not agreed to that accountability yet. Is she wrong? Is she right? Like, I'm confused. I just want to be clear for Canadians.
Yeah, so, I mean, Premier Stephenson speaks for the province of Manitoba and the Council of the Federation. You've also seen a number of premiers over the last number of weeks publicly say that reporting better data to Canadians on the results of their public health care systems. And if the Government of Canada is going to increase our investments, it's reasonable that Canadians should see the better outcomes, the better results, the easier accessibility, whatever the particular metrics that is causing the concern you spoke about. Canadians should be able to see in a transparent way those results. We think that the provinces will want to collaborate on that. The Prime Minister and I and Mr. Duclos are confident that that is the basis of the conversation that we can have with them on the 7th of February. So we don't want to be technical. There is no agreement. Premier Stephenson is right. But as we've also said, we believe there's sufficient common ground now, or a sufficient sort of convergence of priorities, shared priorities, that we hope the meeting on the 7th of February can be the beginning of an expedited and successful trip to get an agreement, or a series of agreements with different provinces, with all the provinces, that will improve the public healthcare system. So one is not in contradiction to the other. The 7th of February is an important, we think, part of getting to that agreement that all of us want to achieve in collaboration and constructively together.
Does expedited mean, in layman's terms, that you anticipate an agreement will be reached prior to the tabling of a budget, of the federal budget?
That would certainly be our hope, Vassy. I said that last summer, that if we can get to the right agreement for Canadians, for the patients of the healthcare system, for the men and women who are working in the healthcare system, all of those people and all of us want to improve the system. So why wouldn't we try and do that work quickly and collaboratively together? In a good scenario, we would leave the meeting on the 7th of February in Ottawa and quickly work with the provinces and territories to finalize what would be those agreements, as the Prime Minister said earlier today. And that would allow our government to book in our budget this spring those increased investments. And the provinces are also in the process of doing their own budget processes for next year. And they too, and they've said it to me and to the Prime Minister, they too will want to know what that number is on the line in terms of federal healthcare investment. So we all have a reason to do this as quickly and collaboratively as possible.
I'm glad you brought up that dollar figure, because if I recall, I attempted to ask you last week exactly what it would be. I know you're not going to reveal that, but I did listen very closely to yourself.
You'll try it again.
Yeah, I'll keep trying until I get it, actually. No, but in all seriousness, I did listen very closely yesterday to the finance minister, the associate finance minister, a number of your colleagues who were very specifically saying that the fiscal room within which your government has to maneuver because of the possibility of a recession and depleted revenues has been reduced, and that there will be hard choices that have to be made. Was that message specifically directed at the premiers?
No, I don't think it was directed at the premiers, Vassy. That is a reasonable conclusion. The government's fiscal position, in light of some of the economic uncertainty that we've seen in recent months, obviously the concern around inflation, what that means for the Canadian economy, all of those uncertainties make the government's fiscal position less certain than it may have been 3 years ago or 5 years ago. There's also COVID, which allowed the Government of Canada to massively increase transfers to Canadians and to provinces in the magnitude, as you've heard, of $70+ billion to provinces alone around the fight against COVID. So the Government of Canada has been very generous, and our fiscal situation, as the Minister of Finance discussed with our cabinet yesterday, is in a different position than it may have been some years ago. But that being said, investing wisely in strengthening the public healthcare system in the country is a priority, and we're prepared to make the investments necessary in spite of the fiscal circumstance, because it is a priority for our government. So the premiers can come to Ottawa knowing that we're ready to make the necessary investments that will get the outcomes that all of us want. But the fiscal circumstance of the Government of Canada, and in some cases as compared to provinces, is different than it might have been a year ago or 5 years ago.
Okay, and just finally, I'm running out of time, but on that point, if the message then, therefore, is not directed at premiers, and from your answer there, I read that it will not be limiting the reduced fiscal room will not be limiting on the amount transferred to provinces, then who is that message directed at? Is it the NDP, and does it mean pharmacare is off the table?
So I wouldn't say it means that there's no limit on the government's fiscal ability in terms of transferring money to the provinces. What I said is we'll have to make difficult choices in terms of priorities. And the good news is strengthening the public healthcare system is a priority. So we'll have the fiscal ability to do with the provinces what we think is necessary. But the government, and you'll see this in the budget in the spring, Vassy, the government is going to have to make some difficult choices around priorities. We did commit with the NDP to a series of 27 precise commitments in the supply and confidence agreement. Obviously, we will respect and implement every one of those commitments, but the government's ability to do things outside of that particular arrangement will necessarily have to be weighed against the financial position we're in now.
Okay, Minister, I'm out of time. Thank you for your time. Really appreciate it. Intergovernmental Affairs Minister Dominic LeBlanc.